too dad waiting.
All right.
Come on. Here we go.
Oh, I know. Sleep medicine. Snoozing wisely. Boom. Welcome to Dad Joke Medicine, episode 5.
Here at number 5, we have the CFP journal. I've torn out all the non-clinically relevant stuff. So it's looking a bit light, but it's not about quality, it's about quantity.
And they...
Is that right?
Wait a minute. That's the opposite. So this is the June 2024 version, and that is right. It is the 70th anniversary edition. Speaking of quantity.
Speaking of quantity, they went down to one color as well, blue.
Yeah, their budget is going down.
They have an old bulletin. I can read the College of General Practice, open bracket, medicine in Canada. They have a seminar on alcoholism, symposium on non-gonococcal urethritis, and then they get right into the business approach to starting a practice. 1, 2, 3.
We're still struggling with the same content in 2024, 70 years later.
Yeah, starting a practice, that's true. That's still something we deal with today.
Yeah, that is our cover critique. So let's move on to not just the medical updates, but interspersed, as always, with dad joke content throughout.
Interspersed
So
everywhere.
in
Beginning, middle, and end.
In this video, we're going to be talking about screen time in children.
Oh, amazing. Yeah, we're going to talk about some of the parent-centered outcomes around screen time in kids.
We're going to talk about choosing wisely, recommendations on type 2 diabetes in older patients.
Amazing. So that's 2 big ones. I just couldn't get excited about this last one.
Oh, that's right. We're going to wrap it up with tools for practice, medications for apathy in dementia.
Sigh.
So let's get started. All right. What is the first article here?
What do we got here? So Screen Time, Sleep in Children. This is by Randy Goldman. He does articles almost every month, so about 10 a year. So we're going actually down to 10 CFP journals a year now. Yep.
Okay. Next one's going to be combination.
Combined July, August. Mm-hmm. Single one in the summer because you're so busy. And then November, December as well.
Cutbacks.
It down to 1.
Unbelievable. Speaking of cutbacks, it's time that my kids cut back on their screen time so they can get a good night's sleep. More importantly, so I can get a good night's sleep.
When you were talking about cutbacks in kids, I thought it was like a circumcision joke.
No, definitely
I would have cut you off. Inappropriate.
All right, so...
Okay, so why don't you give the foreword on this one?
The foreword on the screen time?
Yeah.
Was there a joke there? Because I totally missed it.
You'll go back and watch this afterwards. Just roll it back.
The foreword on the foreskin? Is that what you're getting at?
No comment.
There's nothing to do with circumcision.
Nothing. Come
How
on.
come everything with you ends up being about circumcision?
Okay, come on. Let's concentrate.
So screen time, it is about bedtimes. We're not going to make any blanket statements. Yes, that's right. That is the sign of an exceptional dad joke.
Where do you get this stuff?
From being a parent.
I thought you got it from the database.
The database.
Boom.
Thanks for the setup that I totally just whiffed on. Swing and a miss. All right.
So I continue to hear concerns about parents in my practice about the frequent use of light-emitting devices.
Unbelievable. Can you believe people with their technology and their stuff?
Light-emitting.
None in my house.
My God. Light-emitting devices like a light bulb?
Yeah. Photons just coming at you.
Turn off the lights so kids will go back to bed.
Oh, wait till you see the recommendation on caffeine before bedtime.
Oh, right. Yeah, caffeine in kids. Ooh, hold on for this breaking
news.
news.
It turns out you shouldn't give it to them right before bed.
So bottom line, I'm going to go to this. No screens, lighting emitting devices for an hour before bedtime. Is this groundbreaking or what?
I mean, we've kind of wrestled back and forth. There was the whole no screen time before age 2, and then COVID happened, and suddenly we looked at the research differently.
Free for all.
Yeah,
became appropriate. Canadian Pediatric Society came out with a guideline that said appropriate use, that you can use it to call your grandparents and that. But I think we're seeing a swing back to saying less screen time, more quality, and definitely relating to sleep, not before sleep. My kids go mental. Mm-hmm. Yeah, with screen time.
Oh gosh, yeah.
Right
It's like they could always want more. And it turns out that there is research showing that it does affect melatonin levels. They've measured this.
Yeah. And they used, this is the greatest part, Children's Sleep Habits Questionnaire, delivered by iPad.
So now that you're about to go to sleep,
Confounder in that
turn
study.
on the iPad? So what is the bottom line here? Do not use any screens 1 hour before bedtime for the kids. For
the
you?
kids. For you, totally fine. That's the reason I get the kids to bed is so I can have some screen time. Got to go do my results at
Well, I
home.
can quit whenever I want.
Yeah.
I
Oh,
would
yeah.
be fine without
Yeah.
my necessary wind down time of 2 hours of screen time
Cold turkey off the television.
in bed. There actually, I saw a good video about cold turkeys.
Yeah.
And I was trying to fall asleep last. Dang it! So, all right, we're almost done. Should we quilt while we're ahead, or should we talk about?
Did you say quilt? Quit.
Yes, that's right.
Quilt.
while you're
Bedtime quilt. Does anyone quilt anymore?
ahead. There are 4 other fantastic tips for helping your kids fall asleep.
Oh, important for new dads, new moms out there.
Yeah, we don't
Sort of
we don't
advice.
read journal articles for the medical advice. We read it for the parenting content.
Yeah,
That's
yeah.
why we're here as dads.
Parent-oriented outcomes. This is it. So you know what would work really well if you read this article to your kids.
Yes, they will fall asleep. So read to your kids at bedtime.
Reading at bedtime, we got that low light and noise. And what's this next one?
Yeah,
You
do
mentioned?
not give your kids a Monster energy drink immediately before bed. Who knew that that was good sleep
Have you ever
advice?
done that?
Why would I ever do it? Based on the look on your face.
No comment. Is someone recording this?
They were literally sitting in front
It
of
was
you.
it was non-accidental caffeine ingestion.
Oh my God. Maybe on
I just wanted to see what would happen.
maybe on a holiday.
Not good things.
And then this one is going to break some little hearts. But if the child sleeps in their own bed and not the parent's bed, then there's better sleep for all.
It doesn't actually say that it talks about child sleep outcomes, but it's definitely better
Definitely
for you
better
as
sleep
well.
for all.
Yeah, let's move on.
Yeah, we'll put that one to bed.
Put that to bed.
Put that to
sleep.
bed.
Put it to sleep.
Put it-
I said it first.
put
You can't have the same dad joke as me.
It's obvious it's not. Okay, moving on. Optimizing.
Oh, here we are. So,
Bringing
type 2
Optimus
diabetes.
Prime to type 2 diabetes care.
so what are we doing? What we're back 10 years ago, went through med school. It was we got to hit these targets. We got to get these hemoglobin A1Cs down, down, down. Once again,
so
it's
this
like
is
a band.
a type 2 diabetes article for
Baby,
older
are you
patients.
Down, down, down. Is that a song?
Are you singing or are we doing a podcast? So speaking of songs that none of your 65 or older patients would recognize,
Yeah.
Let's talk about optimizing type 2 diabetes care in our 65 and older patients.
So what are we going to do? We're going to talk about maybe changing the medication, maybe dropping some of the medication and giving them a little bit of a higher treatment goal or a target. So some of these for patients in poor health, hemoglobin A1C up to 9.
Yeah. I mean, I
That
remember
sounds
med school.
malpractice-y.
Yeah, no kidding. The goal for everyone back in med school was 6.5. Make sure that you're
Yep.
physiologic. Okay, probably 7. But now things have just gotten like they were.
Things
in the
got
70s.
sweeter.
Things just
Yeah.
got chill.
We're back at the Woodstock of diabetes management.
That A1C number just goes up year after year after
Year
year.
after year. But it's hard.
It's
'cause
like
you
it's
spend-
like inflation.
Oh, hemoglobin A1C's gone up, inflation has gone up,
Target's
and then
gone up.
but you can actually save money because you can go off medication.
Yeah, so for your patients in poor health, it's okay to have a higher A1C. Then you can avoid hypoglycemia. Then you can avoid polypharmacy. All these things that actually really matter to patients.
This can be challenging. I know I have one patient where he's been stable on his medication for so long now, and you talk about taking medication away. You spent 40 years of your patient relationship saying you got to take this medication, you got to take this medication. It's gonna make you live longer, and then you start saying, "Well, now we got to take it away. It's gonna make you live longer." Like, what have you been doing for the past 40 years?
Who are you? I don't even recognize you.
Yeah, I know. I want my old GP back.
So this was a really interesting Choosing Wisely Canada campaign. They really, I guess you could say, they wise to the occasion.
Boo.
Come on.
Wise to the occasion.
It's a good one. There's a
So
couple other
choosing-
good Choosing Wisely campaigns.
There were some that actually didn't make the cut.
Yeah, I
What
think
was one? You mentioned one to me. I don't remember it
The
now.
dental campaign,
Okay, choosing wisely for dentists is what?
Chewing Wisely. Oh, come
I
on.
can only see one person laughing. There's got to be another one. Give me one more. Go for it.
Hematology.
I'm ready. Okay, what does hematology say?
Bruising Wisely.
Ooh.
Come on.
Okay. I'll give you 2 dads on that one.
Okay.
2 dad rating.
All right. Here's
Come
a
on.
good one.
Here we go.
Oh, I know. Sleep medicine. Snoozing Wisely. Boom.
Oh, I think we'd leave it at that.
Yeah.
That's
so
enough.
If
1,
your
2,
patients
3.
are getting older, their health is declining, don't be afraid to let that A1C number just float up.
Float up
Target A1C.
to heaven. Like your patients.
Yeah, you should maybe just exhibit
No.
more apathy when it comes to their A1C.
Oh,
Notice that?
nice. Good transition. Well done. Medications for apathy in dementia. It took 4 people to write this article. not apathetic. So tools for practice top. I'm sure a lot of people will be getting this by email. So the clinical question they ask, patients with dementia, how safe and effective are stimulants, antidepressants, and antipsychotics for treating apathy?
Yeah, I had a patient
These are elderly
with,
patients.
severe dementia and apathy. And do you know why he went to therapy?
No.
He didn't. Because of his apathy. Oh my gosh, okay. That's the sign of a good dad joke when you have to explain it to the child.
Yeah. It's a great dad joke, but a poor dad.
Yes, exactly.
Sorry, I'll
There's
work on
no patient advocacy organization for patient apathy. They just couldn't get around
They've
to it.
tried again and again.
Nobody cares.
Never. It's just
People have just stopped caring. So this
chronic.
is actually a really serious issue when you have an elderly patient and they've got dementia and they end up with apathy.
So this is it. So methylphenidate, the bottom line here is methylphenidate may improve apathy scores by a small but potentially clinically meaningful amount compared with placebo.
Yeah, so what they did is they followed these patients for 12 weeks and they gave them a questionnaire with 72 points on it saying basically how apathetic are you.
How many of them finished that 72 point?
Yeah,
that's the actual test.
Yeah.
Yeah, what's your score is if you actually make it to the end.
Okay.
I've barely made it to the end of 72
So the folks
question ones. As if you're a medical student.
Yeah,
Can
fair enough.
Can you give methylphenidate to medical students who are apathetic?
I think they're all on it now.
Are they already? Oh,
yeah.
Confounder.
Yeah.
Okay.
So 5 points on a 72-point scale. That's how much apathy improvement you get when you give methylphenidate.
Low dose though, isn't it? It's small. Just is it a teeny bit?
Mm-hmm.
Doesn't improve their cognition. Makes them less.
But for those of you who are wondering about the non-pharmacologic treatments, there's several options.
Oh, okay. So they talked about sensory stimulation, music therapy,
Singing.
You have a great voice
Thank you for
for a doctor.
stepping.
Pet therapy.
There's a lot of good singing doctors. Don't you remember the choirs during COVID? Why did those end?
The choirs.
It was like the Zoom calls of 80 people singing.
No, I thought you meant like the Seattle outbreak that started with the choir. There's got to be some great bands, some doctor bands. Doctor Who?
Doctor Who?
Is that a song? That's not even a band.
I know Metallica has a song about apathy.
What's that one?
Nothing else matters.
Oh.
All right, moving on. Cognitive stimulation, another great non-pharmacologic treatment. Cognitive stimulation and pet therapy.
Okay.
You feel better now? Do you care more?
I really want to move around and
Care
get
about
away.
That's it for Dad Joke Medicine. We're so glad you joined us.
70th anniversary, 5th episode for us. Hopefully we'll make it to 70.